So I had a patient recently that was concerned about the risk of multiple sclerosis medications. For instance, with the medication Tysabri, natalizumab, there's a small risk of a very serious infection. So there's a virus, the JC virus, and we could all be infected with this virus, but typically it doesn't cause any symptoms. The immune system just shuts it down, and it stays in our body throughout our life and doesn't cause any problem. But in very rare cases of people taking Tysabri, the virus can infect the brain and cause this terrible disease called PML, which stands for progressive multifocal leukoencephalopathy. It can be fatal. And with the drug Tysabri, there can be a risk that's as high as greater than 1 in 100. It's a little bit of a complicated science. There's a test called the JC virus antibody that detects if you've been exposed to the virus. And if you've been exposed, the risk is much higher. The risk also goes up if you take it for a very prolonged period of time, and also if you have received other immunosuppressant medications in the past. And it's a very serious concern, especially from my perspective, because I could easily prescribe it to more than 100 people with multiple sclerosis, and one of them is going to get this complication. So I want to give it to people only if they're very low risk, like they test negative for the JC virus antibody, or for short periods of time if they're positive. There's also a test called the JC virus antibody index, sort of the level of positivity, and it gives you a sense of the risks, and there are many statistics available. I've made prior videos on this channel about it. But the point is, it's a serious concern with this medication because no one wants to get this terrible complication. It's a very serious complication, and it's not so extremely rare that it's trivial. However, my patient was not considering this medication. They were considering another medication called Gilenya. Now, PML, even though it's most associated with the drug Tysabri, it can actually occur with any immunosuppressant medication. Pretty much any medication that weakens the immune system. If you look it up, there are at least some rare case reports of this infection, PML. You can't avoid the risk entirely if you're going to take immunosuppressant medications. However, luckily, the risk is extremely low for most medications. And with Gilenya, the risk is reported to be about 1 in 20,000, approximately speaking, exceedingly rare. But my patient, understandably, was concerned about even this risk. And it's an individual thing. To some people, 1 in 20,000, if it's a very severe side effect, may be significant. However, the point I want to try to make in this video is that I think when you hear large numbers, it's really hard to understand that. We can all understand 1 in 2, 50% chance, half the time it will happen, half the time it won't. Or even 1 in 10, it usually won't happen, but occasionally it happens. Like a rainy day in Los Angeles is around 1 in 10, let's say. We can all picture that. We've seen rain, but we know most of the time it doesn't rain. But I think when you're talking about very large numbers, it's really hard to make sense of it. So I looked up the statistic for the probability of dying in a car accident over your lifetime. And I divided it by the approximate number of days the average human lives. And I would estimate the probability of dying in a car accident in a given day is around 1 in 2 million. Your risk of dying in a car accident today. Of course, there's some days you don't drive, the risk is 0, and some days you drive a lot, the risk is much greater. But on average, it's around a 1 in 2 million chance. By the way, I'm driving to LAX airport. I'm going to San Antonio. I'm in a wedding for a friend. And so that's why I'm on the road here. So 1 in 2 million, it's hard to make sense of that number. But if you say, well, what's the risk of dying in a car accident in 10 days? Well, 1 in 200,000. What about in 100 days or around 3 months? Well, it's around 1 in 20,000. So your risk of getting PML, taking the medication Gilenya, is approximately your risk of dying in a car accident in a 3-month period. That really puts things into perspective. You could think about it in a different way. Let's say you take Gilenya for 5 years, because many people take multiple sclerosis medications for many years. Sometimes people change medications for various reasons, of course. And I don't know the average length of treatment of Gilenya, but let's say it's something along those lines, 5 years. And you say, well, in a 5-year period, how many 3-month periods are there? Well, 4 in a year, 5 years, 20 of them. And so your risk of dying in a car accident is roughly 20 times greater over a 5-year period than your risk of getting PML with Gilenya. And of course, you may not actually die with PML. You could survive, and some people have a good outcome. Of course, it's a terrible disease. In other words, if you were to get a slightly safer car, or drive a little bit less, maybe get a job closer to work so you don't have to drive as much. Get a car with better safety features, modern airbags, wear your seatbelt consistently, don't drive while intoxicated or tired. This would probably be much better for your health overall than not taking the medication Gilenya. Now, Gilenya causes a lot of other side effects. It's an immunosuppressant. It can be associated with other infections. It's difficult for me to give an exact statistic, but it's almost certainly the case that your probability of getting some random common infection, say dying of a urinary tract infection, or pneumonia, or a serious skin infection, or various other types of infections or complications of Gilenya. Gilenya can sometimes cause heart block or other cardiac events, typically with the first dose. It's almost certain that the risk of PML only accounts for a very small portion of the morbidity of taking the drug Gilenya. Also, what about the risk of multiple sclerosis itself? Well, many people with multiple sclerosis do very well, especially younger people with relapsing MS. I have patients who are not taking treatment who do well for many years. However, untreated MS, long-term, over many decades, the probability of having some amount of disability, not necessarily severe advanced disability, not necessarily requiring a wheelchair, but having some amount of significant disability is quite high if the person is totally untreated over very long periods of time, probably greater than 50% risk of having at least some significant degree of disability. And when you look at the statistics of, say, unemployment and disability rates of people with MS, they're quite significant. And of course, these statistics seem to be getting better over time. We are diagnosing people with milder MS. We have more effective disease-modifying therapies. But untreated, it's a serious disease. And so my personal view, and of course, it's easy for me to say because I'm not the one taking the medication, is that 1 in 20,000 risk of PML is a very small risk, probably trivial compared to the potential benefit of the medication and compared to the other risks of the drug. And it's just not practical to make a decision based on a risk that's so extremely low, because the risk of life is much greater than that. The risk of any medication is much greater than the risk of bleeding to death due to aspirin, for instance, or developing kidney failure due to ibuprofen, or liver failure from Tylenol, for instance, or having a fall in the middle of the night because you took Benadryl to go to sleep and having a brain hemorrhage. And this kind of thing happens all the time, by the way. And I think it's somewhat of a psychological bias to be very afraid of a strange, mysterious, unusual infection like PML, but not of a common, but potentially equally serious infection like pneumonia or urinary tract infection, which I've seen much, much more commonly. By the way, even with Tysabri, which carries a much greater risk of PML than Gilenya, I've actually never seen a single instance of someone getting PML with multiple sclerosis. I had one patient a long time ago with AIDS who developed PML as a complication of AIDS and immunosuppression from the virus. But it really is very, very rare. And of course, I've seen numerous other complications of Gilenya and various other disease-modifying therapies that are quite serious. But anyway, I'm just trying to make this point about large numbers, and when you hear a large number, like 20,000 might not sound that different from 2,000 or even 200, but they're very, very different numbers, and you should take that into account when making that decision. Now, of course, that being said, everyone is different, and to some people, a 1 in 20,000 risk of a bad outcome may be unacceptable to them. Or just psychological, people may be thinking of a certain type of side effect more than other types of side effects, and they just may be concerned about having that particular side effect. I mean, the idea of a virus infecting your brain is in fact scary. And I think that this sort of bias appeals quite broadly. Like when you think about why do people play the lottery, don't they understand the chance of winning is very low? And I think that people don't, they just hear that they could win a large amount of money, and the odds being 1 in a million or 1 in 10 million or 1 in 100 million, I don't think people can really process that. Those numbers are so large that they essentially all mean the same thing, and people can't really calculate the risk, at least in an intuitive way. But anyway, I'd be interested to know what your thoughts. Of course, being the person with the disease and having to take the risk, you could have a different opinion. There are actually surveys on people and their risk preference. And there was a survey about Tysabri and PML risk. And when they asked doctors said, I'm only willing to accept a 1 in 10,000 risk of PML. And that would essentially be someone who is testing negative for the JC virus antibody. Whereas when they asked people with the disease, people with MS, they actually were willing to accept a higher risk of around 1 in 1,000 risk. So the typical person with MS seems to be less risk adverse than the doctor, maybe because they're more afraid of MS itself. My personal experience is I think people are different. Some people are really not concerned about side effects of medications at all, and some people are very concerned about side effects, sometimes, in my view, irrationally so. Now, I'd be interested to know your thoughts. Would you be concerned about a 1 in 10,000 or 1 in 20,000 risk of a terrible complication like PML if you thought that drug could help with the disease and change your prognosis and you would otherwise want the medication? Or would you consider that to be a trivial risk and you wouldn't take it into account? And let me know if you have ideas for other videos.